My name is Hannah Green and I'm 31. The doctor that was kind of shown as to be, I guess, on staff for that spa, so that's how I found him. And when I was looking to potentially, get some treatment for the scarring on my cheeks, I further looked into him and just based off of his background felt comfortable that, he was someone I'd be comfortable working with. So we're doing Bellafill for my acne scarring on both my cheeks, and then a little bit of Botox on my forehead.
So what we'll be doing is first numbing up our patient, try to make the process more comfortable, and then literally treating each scar individually. So we subsize the scar, which simply means taking a needle, using that to break up the underlying scar tissue, and then fill that void with the filler itself. So basically the idea here is that there's actually a nerve that comes out of your cheek that innervates a big part of your face. So if we can get that nerve numbed up, it'll help a lot of this. I'm gonna do a little bit more just behind that. Next, we want to start actually injecting the Bellafill. So Bellafill works for acne scar really well because the scars really represent areas with lost collagen underneath in the deeper layers, and Bellafill is going to fill that void physically. It's going to fill in the space, but also within the skin it's going to stimulate collagen so the outer texture is improved as well. So you get really both skin remodeling as well as volume from it. So it's Bellafill is FDA approved for 5 years, and that's really a function of that's how long the study was done, the initial study with the FDA, but they're actually working on a longer study, or completing a longer study, so I think the indication will only increase as the length of the study increases. I mean, it's effectively a semi-permanent filler, which is good and bad. Good in that if we like results that we're happy with, it's a wonderful thing, but it also means you have to be super careful with that. You doing okay?
Mm-hmm.
Everything's looking good, as you can tell. I'm just little bits at a time here. Pain-wise, is it tolerable, or do you need a little more numbing?
It's tolerable.
Yeah, okay. I know it's not done, but I'm actually going to add a little more numbing out here just because I see some spots I want to treat that might not be as. And then you're going to feel this little vibration device that can make the numbing going in a little easier. You can see a difference between here and here right now. Those spots are a little bit more noticeable still. If you look at that spot really carefully, you'll see that gently fill in. Keep working around the perimeter of it. You understand?
Mm-hmm.
Good, so let's go to the other side. So let's focus on this one right here. And this one's got a depression that's pretty clear. I think you'll be able to see this nicely. This is gonna work on just one spot so you can see very directly how this works. I'm just putting in tiny, tiny bits at a time, going in multiple kind of layers and times, breaking up the scar tissue. Now I'm working a little bit lower. So I want nice, smooth edges here. So in a second, I'll remove this and see how this looks. So that area is looking really good. I'll do a little bit below that. Pain-wise, you doing okay still?
Yeah.
Beautiful. So lastly, let me just take a look at your forehead, raise your eyebrows up, and relax. So this side of the muscle is a little bit stronger. So lift your brows up and relax. So I'm just finding the spots where the muscle seems to be creasing the skin the most. And lift up again and relax. The other key here is that I'm trying to stay high enough that I get lines, but I certainly don't want to drop your brow. I don't want, if anything, your brow to come up in the slightest. Lift up again, good, and relax. Good. Very good. Okay, go ahead and relax. Last spot here. So I'm going to get your fresh ice pack. Get you a couple of ice packs and we'll get you going. Now for the Bellafill part, I'll want to see you back in about a month or so, just to check and see how everything's looking.
Okay.
And that session will be too soon to add more, but I just like to kind of follow you throughout the process to make sure everything is kind of developing the way we expect. Okay. So I hope you found the information on acne scarring useful today. If you did, please hit that like button and subscribe to our YouTube channel. You'll find some more information on our Instagram and Facebook accounts where we'll show before and afters of some of the patients we've treated with the Bellafill that we talked about earlier today. Thanks very much for joining us.